Treatments for mercury poisoning. So, for the mercury poisoning, the mercury standards and the regulations are the first and the top route for the limit of mercury in occupational exposure. In the workplace, the elemental and the compounds of mercury have a TWA. It should be all of the elemental and the compounds of mercury in the workplace should under 0.025 microgram. This is very important for all occupational exposure in China. And how to do the diagnosis? We can use the blood test for the acute exposure, because for the acute exposure, the concentration of the mercury is quite high. But for the chronic exposure, we can test the urine test. For the urinary mercury concentration, this is the method used to determine the worker's actual exposure to the mercury with the 0.01. Because workers' exposure in the manufactories with mercury for quite a long time, so do the urine test is a better way for them. This is a patient digested 8 ounces of mercury. You will see the shining small balls from X-ray. And how to do the treatments for mercury poisoning patient? First, it depends on the form of mercury exposure. If it is elemental mercury or mercury salts, we can limit the exposure. This is very important. And besides limit exposure, we can do the chelation therapy. The chelation therapy is working for elementary mercury poisoning and mercury source poisoning. But for organic mercury, there is no antidote. So we only can do the supportive care for this patient. And the patients with organic mercury poisoning, they have poor response for the treatment. So in this situation, supportive care gets more important. So for the treatments for all 3 different forms of mercury, remove from source are the top treatments for all the patients. For example, from this X-ray picture, we'll see this patient with 8 ounces mercury, elementary mercury inside. So remove it is very important for this patient. And for the patient, we also should do the supportive care. The supportive care particularly important with inhalation. With inhalation, mercury goes in and supportive care are very important. We also can use the drugs, DMPS, chelation therapy. The DMPS chelation therapy is a choice for the mercury poisoning. It is for both acute and chronic mercury poisoning. But remember, it's only for the elementary mercury and inorganic mercury poisoning. So DMPS chelation therapy is very good for the inorganic one and the metallic one, but for the organic one, it's not very useful. We also should do the symptomatic patients and do the test for blood and the urine mercury persistently to make sure you remove the mercury from your patients. So the treatments, first one we should do remove from source, and we can give the patients with supportive care and give them chelation therapy and check their bodies persistently. So let's do the conclusion for mercury poisoning. For mercury poisoning, we can find mercury from occupational exposure. We also can find it in our household exposure. Please think about where we can find mercury in our daily life. The second one, we talk about toxicity of mercury. It can go inside through inhalation, and the skin GI absorption can also absorb the mercury. The most important, we have to remember the symptoms of mercury poisoning. The symptoms of mercury poisoning, the main targets are the CNS and the kidneys. So you will find the patient with CNS and kidneys problem. And the symptoms also depends on the duration, forms of mercury, organic mercury poisoning and inorganic mercury poisoning and alimentary mercury poisoning. The symptoms are different. For all three different kinds of forms of mercury, the treatments, the very important one is remove source of the mercury. And we do some supportive care for the patient. And we also can use chelation therapy for the patient. So this is a conclusion for the mercury poisoning.